Good afternoon, everyone, and welcome to today's webinar on COACH's eSafety Guidelines, Getting Real with Patient Safety for Health Information Technology. I'm Anna Sherlock, Clinical Leader with Canada Health Infoway and moderator for today's webinar. Before we get started, I need to go through a few housekeeping slides. Please note that this session is being recorded and may be posted on Infoway's website and used for future internal or external education sessions. As Tommy mentioned, please use the Q&A feature if you wish to ask questions. To access the Q&A feature, go to the bar at the top of your screen and click on the drop-down arrow and click Q&A. Once you have finished typing in your questions, please send to all panelists. I will pose the questions on your behalf, and your name will not be used. And lastly, it wouldn't be a proper webinar without an official disclaimer slide, which I will let you read on your own. And now we can get to the good stuff. I would now like to take the time to introduce the presenters for today's webinar. The gentleman located in between the two lovely ladies on the screen is Grant Gillis. Grant is the Executive Director, Forms and Practices at COACH, Canada's Health Informatics Association. In this role, Grant is responsible for the Canadian Telehealth Forum, the COACH Clinician Forum, along with various communities of interest, as well as directing COACH's health informatics practices, including privacy and security, eSafety, and associated offerings and events. Grant's career began in the healthcare administration field, having served in corporate management capacities with the Royal University Hospital, as well as the University Health Network. Prior to joining COACH, he held leadership roles at eHealth Ontario, Canada Health Infoway, and the Canadian Institute for Health Information. Welcome, Grant. Also presenting today is Elizabeth Keller. Elizabeth is the Vice President of Product Management and Operations at Ontario MD and COACH Board Director. As Vice President Product Management, Ms. Keller is responsible for EMR products, specifications, vendor management, and operations. She is presently leading, with her team of stakeholder communities, the rollout of Ontario's Hospital Report Manager solution provincially, and working with physicians to improve the functionality and usage of EMRs. In addition to her hands-on eHealth experience and over a dozen years of consulting experience with IBM and PricewaterhouseCoopers, Elizabeth volunteers her expertise and leadership heavily in the healthcare community in Canada and internationally as a Standards Council of Canada delegate for Health Informatics with ISO. As a COACH Board Director and Chair of COACH's National eSafety Committee, her current focus is building capacity for the next generation of leaders in health informatics here in Canada and spreading the word globally on ensuring safety in our eHealth systems. Welcome, Elizabeth. Within the next 60 minutes, I will provide a quick overview of Canada Health Infoway and the importance of patient safety in the digital health landscape. I will cover the learning objectives of today's session, and then we'll turn it over to Grant and Elizabeth for the feature presentation. If our timing works out well, we should have anywhere between 10 to 15 minutes left for questions. For those of you who may not be familiar with Infoway, we are an independent, not-for-profit organization funded by the federal government. Infoway helps to improve the health of Canadians by working with partners to accelerate the development, adoption, and effective use of digital health across Canada. Through our investments, we help deliver better quality and access to care and more efficient delivery of health services for patients and clinicians. Today's webinar was brought to you by Infoway's Clinical Adoption Team. One of the roles of our team is to provide thought leadership and knowledge translation around change management, benefits evaluation, adoption, and best practices in clinical informatics. Part of our strategy is to ensure clinical value is achieved through our health information technology investments. We do this by actively engaging the healthcare community in leadership, practice, and education. In a few moments, you will learn about the eSafety ecosystem. Canada Health Infoway plays an influential role in this ecosystem through our work with standards, interoperability, and direct engagement with patients, frontline clinicians, vendors, faculty in the health sciences, researchers, and professional healthcare associations. Patient safety is a key priority for Infoway and the clinical adoption team, and as such, we believe that each of our stakeholder groups plays an important role in promoting patient safety and reducing adverse events throughout the entire life cycle of information systems, from the development and design of information systems to the active use by frontline clinicians. During today's webinar, learners will gain an understanding of the foundations of eSafety and how Canada is leading globally in the development of needed guidelines as a risk and change management tool and approach. Learners will identify practical approaches to designing and delivering an eHealth safety program, and also understand your role as a health informatics expert in applying these leading practice guidelines in your organization. Learners will also learn how COACH guidelines are being used and applied in Canada. So without further ado, I will turn it over to Grant for our feature presentation.
Thanks very much, Anna. And on behalf of Coach and Elizabeth, very much want to thank Canada Health Infoway and the clinical adoption team for welcoming us to this national webinar. We very much appreciate the opportunity, and we certainly want to thank our audience and participants for taking time out of their busy schedules. You know, many of you are either getting ready for vacation or looking forward to a vacation, such that these are hectic times. Our presentation today, as Anna's already shared, is our new eSafety guidelines, and the title is Getting Real with Patient Safety for Health Information Technology. Next slide, please. So a little bit about COACH. If you're not already a member of COACH, and we know that we count on almost 2,000 COACH members from coast to coast to coast across Canada, our vision is to take health informatics mainstream. For years, working with Canada Health Infoway, Canadian Institute for Health Information, our jurisdictional partners, and many others in the public and private sector, we've enjoyed, I think, here in Canada, an immense improvement in terms of automating our systems, making our health information systems more digital, and the efficiency and efficacy that that's brought along, including focusing on our topic today of the benefits for patient safety. COACH, as a Canadian organization supporting the health informatics community, has been around for almost 40 years. Next year is our 40th anniversary, and we will be having our annual eHealth conference here in Toronto. So if you're able to join us, certainly look forward to meeting you and welcoming you to the eHealth conference, but we'll have celebrations and events going on throughout the year. Again, we look forward to seeing you next year and being able to welcome you to the eHealth event. Slide, please. So as the Canadian Health Informatics Association, we are the voice of health informatics. We work to promote the adoption, practice, and profession of health informatics across Canada in the public and private sectors, in the academic institutions where the next generation of health informaticians are being trained, but also with the many, many thousands of health informatics practitioners, clinicians, vendors, software designers, academics working in the field already, again, working to promote the profession of health informatics. We are a community of accomplished and influential professionals. We believe passionately that health informatics can make a difference to healthcare delivery and the quality of health that we provide for our Canadians across Canada. But as a profession, we look forward to working with you, our stakeholders, and our members to helping you realize your full career potential, and in that, to advance the health informatics profession, again, for the ultimate benefit of healthcare and for the benefit of Canadians. Next slide, please. So we are the professional home for individuals, again, engaged in the adoption, practice, and profession of health informatics across Canada. We provide networking opportunities, such as this opportunity, working with partners like Infoway and others. We work to provide informative content on health informatics, whether it's with respect to privacy and security, on this occasion, eSafety, or a whole host of other opportunities and topics such as EHR governance, white papers, seminars, workshops, and the like. And what we believe to be top learning opportunities that are of value both domestically as well as internationally. So with that, I think I will hand over to our speaker today, Ms. Elizabeth Keller, and she's going to talk to you about where are we today with eSafety in Canada and who's leading the way. Over to you, Elizabeth.
Thank you so much, Grant, and I'd just like to echo some of your comments made. A huge thank you to Canada Health Infoway for hosting this session. Canada Health Infoway has been with us from the start of this journey in eSafety over 2 years ago, and is also been very supportive of how we're moving forward with eSafety in Canada. So I'm thrilled to be here, sitting here in Toronto, looking out over downtown Toronto, and I'm even more thrilled to be looking at all of the attendees on this call. I can see representation from across Canada. I can see friends and colleagues that are on the line, and I can see new friends and colleagues that I haven't had the chance to meet yet. So I really, really do echo Grant's comments, thanking you for your time in participating today, and really encourage you to think about some of the questions you might have in eSafety, and feel free to ask them at the end of this session. We're really looking forward to engaging with you on this topic and moving forward together in terms of how we can tackle this challenge around eSafety and how we can involve every stakeholder in this journey to gain awareness of why eSafety is important. So without further ado, I want to get moving forward in terms of where we are today with eSafety in Canada, and talk about who has actually used these eSafety guidelines within Canada to promote the professional practice and improved awareness around eSafety. So first of all, on slide 16, which I'm working with here, the eSafety program and guidelines that COACH has come out with are really based on a huge amount of work done by an expert panel who's come together to actually give us guidance and advice on how to move forward with eSafety in Canada. We then took these eSafety guidelines that were developed over the last 2 years or so, and we trialed them with 8 volunteer organizations across Canada on current eHealth projects. Those trial participants were really key for us in terms of being able to learn whether this guidelines tool was going to be effective in terms of being able to push forward on eSafety. So those trial participants, as you can see on the slide, we had GE Healthcare, we had UHN, we had the Ontario Telemedicine Network, we had Ontario MD, and we had the Newfoundland and Labrador Centre for Health Information and AGFA Healthcare, all contributing in terms of trialing the guidelines and testing them on their current eHealth projects to see if they were actually useful, easy to use, and giving us comments in terms of improvements. The thing that you'll note here is that not only did we really work towards getting various jurisdictions helping us out to trial the guidelines, we actually had a mix of vendors, healthcare organizations, eHealth agencies, and deployment experts, just to show that this is not just the case of having responsibility on one stakeholder or another, but really trying to get the whole ecosystem involved in terms of greater responsibility towards eSafety. And I'll tell you a little bit about what that journey was like from a trial participant perspective near the end of this presentation, as I personally went through this trial for the safety guidelines on one of the healthcare projects that we were moving forward with in Ontario called Hospital Report Manager. And I'll share with the group here today what that experience was like and how the guidelines helped us prepare for that go live. To start with, in terms of eSafety, I think I really want to emphasize that eSafety is really coming to the forefront of healthcare delivery in Canada and internationally. It's going to be one of those new paradigms that people are hearing about and need to develop awareness about, very similarly to how privacy and security emerged over the last 10 years or so. most of us are quite comfortable in terms of understanding privacy and security. We throw around terms like PIAs and TRAs like there's no tomorrow. It's part of our normal lingo. Moving forward, we're going to start seeing that eSafety is now going to become part of our new norm as well. And so we really want to get the word out in terms of what eSafety is and why it's important. So I'm going to talk a little bit about that journey and how we got here. So it really started at the global level, and that is, again, thanks to Canada Health Infoway support. They send a team as part of their Canadian delegation to the International Standards Organization to help develop healthcare standards globally. And as part of that delegation, and Grant's also part of that delegation, as well as others you might be familiar with, like Neil Gardner from Saskatchewan and Mike Nussbaum from BC. What we came up with at the international level is that we really didn't have one standard that we could apply to ensure safety across the whole software development lifecycle. We had a collection of many standards, many wonderful standards, but we didn't really have an understanding of how we could ensure safety from the start of the development lifecycle in the design phase, all the way through the implementation phase, all the way through the decommissioning phase of any eHealth system in particular. And what we were starting to recognize was that even in a later phase like a decommissioning or of a legacy system in eHealth can introduce some risks. So at the global level, we really started to ask ourselves, first of all, is there a standard or a technical report that we can work on to identify this issue? And then secondly, what are we doing in Canada about this? Have we even started to raise this awareness from a safety perspective in Canada? Who are the leaders in Canada that would want to listen to us on this topic, et cetera? So we actually not only started and developed that ISO technical report 17791 on guidance for standards for enabling safety in health software, we also engaged with healthcare experts from the UK, Australia, the US, and many others globally to find out what they were doing around the world on this topic. And I'll tell you a little bit about that journey. In the meantime, in Canada, we also identified our eSafety leaders. So when you look at the ecosystem in Canada, what we wanted to really encourage right from the start of this initiative was that everybody has a role to play, and everybody has some responsibility when it comes to eSafety. Classically, in the past, what we had been finding was happening was there was a lot of reliance and even blame on the vendor community in terms of eSafety. And what we were starting to realize that was even the best product can be implemented properly and with extreme responsibility can still introduce eSafety risks because of the way it's implemented, the workflows involved, and the user and the use of the system by the user itself. So it's not just a question of vendors and their products. This is really a question of everybody having a role to play in how their eHealth solution is working within their community. So we actually got together all of these groups that are identified here and made sure that they were aware of the issues. So we had all the medical associations comprised of physicians, nurses, and even the Patient Safety Institute come together along with CIHI, Canada Health Infoway, the jurisdictions across Canada, and a lot of the academics and researchers to really come together and tell us what we can do and how we can start forming these guidelines. And this was the group that actually, over the last 2 years, came up with these guidelines. So it took us a long time in terms of a journey, but it was developed with a lot of hard work and a lot of people involved, a lot of expertise, especially in usability. So I want to go back to why it's important and what have we learned. So when you look at the next slide in terms of what are we actually talking about in terms of adverse event examples, some of these examples come directly from the National Health Service. So you can see a lot of them you may be familiar with or even have experienced within your own organizations or eHealth projects. There's the types of alerts where the system fails to produce the appropriate alerts for patients, such as drug allergies, et cetera. You have patient misidentification, so that means the wrong report going to the physician, You have software maintenance isn't updated and fully tested, so the wrong lab reports are going to the wrong physician, drug mapping errors, incorrectly computed ages when you're doing some screenings with your roster. So these are all examples that the UK came up with. We also just recently saw a report come out, an article from the American Medical Informatics Association in April this year, documenting a very similar incidents in terms of Veterans Affairs in the U.S. And this article actually is a lot more detailed in terms of the type of incidents that they're seeing within their EHR and how they're dealing with it. So I think, and if you go to the next slide, you can also see that in the UK, they are sharing with us that they have an average of 35 documented software safety incidents per month. Now, while not all of these result naturally in any harm, they can be categorized as what we call near misses or potential events. So, of course, we're trying to control that risk. And so recognizing that there is still a risk around eHealth, we're trying to minimize that risk as much as possible and come up with a proactive approach using risk management processes to actually get those numbers down. And the first step is actually identifying that those numbers actually exist. So I think everyone can understand that there is a burning platform here, that we have a situation where, yes, eHealth is a wonderful thing. It actually introduces a lot of efficiencies, a lot of increased safety and security, but there's also a recognition that we need to be aware of unintended risks that may be being also introduced, and how are we going to deal with those from an eHealth community perspective. So this is very much a proactive risk management approach, and developing these guidelines was really based on what we saw, the approach that the UK took. So in the next slide, the National Health Service was really the basis of how we developed our program in Canada, and we took a lot of advice from England in this space, and they had a very formal training program and certification program that they offered since 2005. And they have over 1,000 accredited clinicians in the UK that are focused on safe implementation. And very interestingly their clinicians also have to sign off on the case for safety prior to going live. So as you can imagine, that puts a lot more emphasis and responsibility on the clinicians to become involved and aware of what is actually going to transpire in terms of their eHealth solution, and also encourages a lot more questions to be asked and a lot more risk management to be applied. In the U.S., on the other hand, on the next slide, the Institute of Medicine came out with a wonderful report in 2011 that also really emphasized the need for eSafety as well. So we went down to the U.S. and talked to the folks at the Institute of Medicine. We also talked to the folks at the National Health Service, and we want to find out, so which approach should we take in Canada? Should we develop guidelines or should we develop regulations? What would be our approach in Canada in terms of mitigating this risk? What a lot of the advice came back from the players globally was around starting with a softer approach that was focused on guidelines rather than specific regulation to deal with this issue in Canada. In the U.S., when they had taken a potentially harder approach to it from a regulation perspective, what they had found was it actually alienated their vendor community and made it so that it turned into a more adversarial approach to eSafety. And what the UK had found was that the introduction of guidelines, training, best practices was met with probably less resistance. So we chose in Canada, based on our stakeholder input and discussion, to start with a guidelines approach. We'd found and used that approach in the privacy space, and Coach had come out with their privacy guidelines in the past. And we thought that we could start with a guidelines approach in eSafety, build our community together so that we get all of our stakeholders involved, like vendors, like clinicians, and like eHealth implementers and health informatics experts, to come together and develop guidelines so that we can deal with this and tackle this problem together. So on the next slide, the premise of eSafety, this is why we decided to go with coach guidelines. It was to protect the patients against risk and harm. We are being proactive, and we're also trying to build trust with all the stakeholders and get everybody involved. So as discussed, it was backed by the evidence and international learnings that we gleaned around the world. And right now, the guidelines are actually considered leading practice globally, and we have a lot of other jurisdictions like Australia considering using the guidelines in their jurisdictions. So they're being very well received around the world in terms of leading practice. So I'll tell you a little bit more about those guidelines and how you use them. So the purpose and the goal of the guidelines was not only to provide awareness and education, it also gives a model for developing a program within your own organization, and it gives ideas around how to implement and monitor and report on eHealth safety. So in Canada, we're working with the Canadian Institute of Health Informatics to really, Health Information, sorry, to develop some categories in terms of reporting so that we can actually start benchmarking where are we in Canada with regard to eSafety. And then we also want to, on the other side, encourage the use of guidelines and standards to tackle some of these eHealth safety challenges. So the principles on the next page, when you look at the principles that guide eSafety, the underpinning, and sorry, our slide's stuck there. There we go. The underpinning of eSafety, as you can see, is really establishing that safety culture and that accountability. So for those of you on the phone, within your own organizations, you can ask yourself this question, you know, how would I start to tackle this question within my own organization? How is my organization tackling this? And then we can get into what kind of tools can be available. But the main pillars, as you could see, were really quality management, risk management, as well as human factors and reporting. So on the next slide, you can see that it engages all stakeholders, like I've talked about in the past few minutes, really involving the developers, the implementers, the operators, and the end users to ensure that you're getting eSafety throughout all your eHealth experience. So I want to really focus in on culture, because culture and changing culture is very, very important in terms of ensuring the effectiveness of eSafety. Culture, as you know, is really based on change management principles, and so one of the leaders in change management is Cotter, and John Cotter had a great model in terms of how you can move forward with any change management challenge that you might have, and it really starts with establishing that sense of urgency. And I've told you today about the sense of urgency, why we're doing eSafety, because we know that there's documented eSafety incidents. Your next challenge is creating that guiding coalition, which we did in Canada with our eSafety Council, develop a vision and strategy. In Canada, our strategy was really to get the guidelines together and trial them, create short-term wins. So in our case, it was really looking at how we can actually trial these guidelines in Canada, learn from them and apply them, and then consolidate gains and produce more change. So when you see that depiction that we are here, that is us globally, Canadians as a whole. However, it's really just starting out, and we'll repeat this journey over and over again depending on where you are within your own organization in terms of your maturity. And I'll talk a little bit about that, how patient safety, as you know, has been around for a long time, especially in the hospital sector, acute care space. This is not a new topic. However, in terms of eHealth safety, that is really where we're starting out our journey from a system perspective to ensure we've really mitigated risk throughout all of these various systems. So I'm going to skip over the next slide in terms of culture. It gives you some tips in terms of how you change the culture. And talk a little bit about whether you feel your organization is ready for eSafety. And I think a number of different factors are important, but when we talked with our trial organizations on what they felt was really important to make it successful in their organization, they told us that senior leadership support was key. They came from learning organizations that were not concerned about talking about their potential failures and learning from them. Strong staff morale, adequate resources, et cetera. And then really working towards the commitment of continuous improvement, I think, is part of that picture. So if you go to the next slide, and I'm going to actually, this is your classic change management awareness through adoption perspective, and I think this is the one that we followed in Canada to start out on our journey with awareness and going out and talking on webinars like this. We also had commitment from a lot of our trial organizations, and we now have adoption of these guidelines by several jurisdictions across Canada to actually change the way they're delivering their eHealth systems. So everybody is going to be different in terms of their journey. Some of us are going to be at the beginning and just developing awareness. Others are going to be more advanced. This is how we're going to actually build on eSafety in Canada together. At the next slide, if we actually skip over, this is our eSafety maturity model. And if we go to the next slide, it would be really interesting to ask yourself the question of where you fall or your organization falls in terms of their maturity in terms of eSafety. So when you look at level 0, there's really little or no recognition of the need for addressing safety with respect to eHealth systems. And that could be some of us. When you go up to level 2, let's say, there's an eSafety framework in place, but there's not a lot of management support or resources to really make it effective. When you go all the way up to level 5, which would mean you're on the most mature scale in terms of eSafety, you're really seeing a much more formal recognition of that eSafety program, policy, and supporting processes in place. It's also documented and well integrated in terms of the enterprise risk management approach. So I'd love to have you think about that in terms of your individual situations. And at the end of the call, I'd even like to hear whether you've ever experienced any potential near misses in any of the eHealth safety initiatives you've been involved with, because really part of this culture change in Canada is getting people to talk about it. And recognize there's absolutely nothing wrong with talking about what we're learning and how we can improve on it. So when you go to the next slide, I think I've emphasized enough that it's really all of us working together. And then on the next slide, I really want to talk about the practical approach to developing an eSafety program within your own organization. So how do you do it? I'm going to tell you a little bit about how we did it at Ontario MD from an HRM, Hospital Report Manager Solution perspective. But here you can see we provided the actual model in terms of a step-by-step approach that you can follow within your own organization to develop an eSafety program. So it begins at the top with really having that management commitment to eHealth safety. And in terms of your own culture, a good way to score this is actually to approach your senior level executives, your senior level, your senior management team, your CEO, your board of directors, and ask them the question of what their risk tolerance is towards a potential eSafety event occurring. What you're going to hope that they say is that they have a low risk potential and they really wouldn't want something like this to happen. And then you can use that low risk tolerance to then say, okay, well, if that's the case, would you be willing to move forward on an eSafety approach where if we were to identify potential issues, we could have your support in getting, in working those through in terms of before we go live with any eHealth system. You develop your eHealth safety program then with the support of your senior management, and you move into looking at previous documentation that you might have. So you could start this at any phase in your project. You might have a risk management, you might have a PIA already done, a privacy impact assessment, you might have a project charter that you've developed, you might have a product design that the vendor supplied to you. Really what you do is you actually start by assembling some of your documentation together, and then you do a formal assessment in terms of eSafety risks. So with getting your team together, you do a risk assessment and you build on and deliver on an eSafety case. And I'll walk you through an eSafety case and how we actually develop that on the next few slides. So in terms of your eSafety case, what we're really trying to do here is to develop that eSafety case prior to a go-live or implementation. And it can be done, as I said, at any phase in the project. And really what you're trying to do is ask yourself, what can possibly go wrong? And so you really set that risk tolerance that I told you about, which was a low risk tolerance, identify what risks are at play, and determine your scope for the eSafety case. And then you follow the methodology that I'm going to walk you through in the next slide. So you really work at, as I said, consulting and communicating within your organization. So you assemble the documentation and your team. A lot of the time, what we saw with the trial organizations, the team is usually comprised of, if you have a product manager of your particular eHealth product that you're implementing, or you have a project manager, those are often the roles that are played in terms of assembling the team together. If you have operations folks, it's often great to get them involved. And naturally, if you have your clinician advisory group that a lot of eHealth initiatives now have, it's great to get your clinical champions involved right from the beginning so that they understand the workflow, impact, risks. And then you have a team that you can move forward with in terms of establishing the risk tolerance threshold, and really talking about what some of the factors are. So you get your risk assessment completed in the third step. You document your data flows. That's very important, is really looking at, as this data flows through the system and through the various solutions provided, what are the risks of that data actually changing or being corrupted or being lost or being misidentified in any step of the way. And then you talk about your risk treatment. What are you going to do about it? You know, what in the hospital report manager example, if a physician identifies that they have received the wrong report for the wrong patient, do you have your processes outlined so that the physician clearly knows who to call, how to correct that, and identify to the system that this has occurred in the first place so that we can ensure it doesn't happen again? And then you have your monitor and review over and over again. So as we move forward on the next slide, we actually, in the guidelines, we provided 2 case studies so that if you're trying to understand how to apply these guidelines, we had a very simple case study based on a physician EMR implementation, and we had a more complex implementation example with a telehome care and regional health authority. So that gives you some examples in the guidelines of what we're actually talking about in the scope. And then on the next slide, you can see in these guidelines, we actually also include very, very practical tools for you as professionals to use so that you can use these checklists through all your implementations or programs or projects and ask yourself the right type of questions and help identify some of the risks that maybe you didn't even think about. We're not all human factors experts. We're not all usability design experts either. Each of us has a different lens that we usually apply to our eHealth projects. Some of us are experts in project management. Others are experts in technology or change management. And the secret here is to ensure that you can remove some of the blinders that you might have from your vision and actually use some of the checklists as a team to make sure you've covered off a lot of these risks. So they're very practical tools. We recognize that nobody's going to pick up a book of 100 pages of guidelines and figure out how to apply them within their organizations, but rather they need practical tools that they can quickly use and apply. So on the next slide, and a risk register, many of you have seen a risk register before, but we do, you know, that's one way to help your organization track some of the risks with regards to eSafety. On the next slide, I want to talk a little bit about the frontline tales from Ontario, Manitoba, and Saskatchewan. So as I said, we have a lot of the jurisdictions now working with us and becoming more comfortable about talking about some of the examples that they're starting to experience across the jurisdictions in a lot of their EHR projects, as well as other eHealth related projects. And some of the examples that we're getting across the jurisdictions are related to client, provider, and identity issues. So that's definitely one of the most common that we're seeing, is that either you have the wrong patient identified or the wrong physician identified. So that's proving to be one of the issues in Saskatchewan that they're very cognizant of and tackling there. In Manitoba, they've got a functioning EHR in Manitoba that's proving to be very interesting to watch in terms of ensuring proper data quality. Because as you can imagine, if there is an error on one of your reports that's going into the EHR and somebody picks up that report as a clinician and acts on it prior to the report being fixed, if there's a mistake in it, it can actually introduce eSafety adverse events. So they have a team in Manitoba actually in place that's dealing with eSafety, and they're being very proactive in terms of ensuring proper data quality and dealing with missing information that's happening within their EHR. So they're being very proactive in Manitoba. In Ontario, in some of the examples we're seeing from some of the eHealth projects coming back, we have the report being sent to the wrong physician, missing hospital name on some of the reports, or reports being delayed through various systems. So when you look at the complex ecosystem that most of us work within, it's not just simply sending a report from a hospital to a physician anymore. Many of us are dealing in ecosystems like in Ontario, where you could be sending a report from a hospital into a provincial hub. From the provincial hub, it then goes to a hospital report integrator. The integrator engine then sends it to the CRIS system, for example, in Ontario, to append the HealthLinks information, and it is then sent on to the EMR. So that's 5 points of potential failure or error in data. And so you have to be cognizant that it's not just simply your own scope that you need to be aware of, but you need to work with your partners and actually be able to work together to say, okay, if this is working within my own area, but I see that there's a potential risk in the way the hospitals are actually codifying their information, then you need to work with the hospitals and proactively come up with an approach and a standardized way of tackling that problem. So I'm raising these examples in a positive light because I think it's really proving to be very interesting across Canada how we're coming together as a community to talk about these examples. And I'd love to hear some of your examples at the end of this phone call if you have any, or any ideas where you've experienced this as well. Next slide. So I think we've talked about the hospital report eSafety case. So we went live last August with Hospital Report Manager in Ontario. And I can say that having been able to go through the exercise last summer of using the coach guidelines and really looking at how we were going to deal with any potential events as they occurred, did really help us in terms of less sleepless nights prior to go live. So it was really nice to know that all those things you lie awake with at night as health informatics professionals, and especially those of us that are responsible for really live systems and clinicians, you know, you really want to make sure that whatever you're going live with is not going to produce any risk or adverse events. So in Ontario, we actually developed the case for safety. We worked with our physicians, looked at their workflows, tried to think of at any point what could possibly go wrong. We had an eSafety team assembled. We had processes in place to deal with any potential questions or events as they occurred. And we established a regular user group that meets quarterly to actually tackle any potential long-term questions that we need to deal with. So it really was a great way to actually make sure that we could go live in safety, but also establish those ongoing processes so that you can work on increasing eSafety over time. So these user groups actually work with us on our HRM roadmap and identify any potential issues that they see in terms of risk, and we actually develop strategies based on clinicians in this case. It's physicians, nurse practitioners, and clinic managers to actually help us react or proactively anticipate any risks that might come up. So if we go to the next page, so as I said, we really built on what we already had. So this wasn't that we had to establish a lot of new procedures per se, because we were already deploying EMRs across the province to physicians every day. We had a lot of this in place. However, we'd never really looked at it from a holistic eSafety perspective and looked at what can possibly go wrong beyond the doors that we were responsible for. And so asking ourselves the hard questions of how we can help hospitals and provincial document repositories also manage their risk around eSafety. So your PIAs and your privacy impact assessments and your existing documentation is probably a great place to start if you're really looking at how to develop this case for safety. So on the next slide, it's simply a quote from our physician champion, Darren Larson, who really felt that using the COACH guidelines was really helpful prior to go live. And again, very much building on the National Health Service in the UK, we really felt that involving the clinicians up front and ensuring that they were comfortable prior to go live was very, very important. On the next slide, so where are we going next with in eSafety, and then we'll open up the floor for questions. So in terms of next steps for eSafety in Canada, we have these guidelines that are available for purchase or license through COACH. And we have this eSafety Council that's established and that all the jurisdictions participate in. So whichever province you may belong to, there's a good chance that your jurisdictional lead on this eSafety Council is already considering a jurisdictional license for your province. So what I would do is encourage you, if you are interested in understanding what your jurisdiction, say Alberta, is doing, contact COACH, and they can answer your questions in terms of the guidelines and who you can contact within your own jurisdiction to talk about how you can work on getting those guidelines. We also want to continue to provide awareness and education, and sessions like this is great. So I'm looking forward to your questions and really building on that adoption throughout all the jurisdictions. So I think we can probably open up the lines now. A huge thank you once again. And I'd love to hear from those on the phone, any of your questions that you might have around eSafety. I'd also really like to hear if you've ever experienced an eHealth related eSafety event within your own organization or jurisdiction. You don't have to name names of the project, and you can just keep it in a high-level example if that makes you feel more comfortable. And also maybe hear about where you feel your organization or jurisdiction is in terms of eSafety maturity. So those are just some ideas for questions, but I'd really like to hear from some of you.
Great. Thank you, Elizabeth and Grant, for that fabulous presentation. Again, please use the Q&A feature from the drop-down box in the toolbar above your screen. Okay, so just looking at the questions here, our first question is, how is eSafety being embedded into the more traditional role of quality and risk professionals within Canadian healthcare organizations?
That is a fantastic question, and I think it really depends on your organization. So as I said, what we've seen is many organizations that are further along in terms of maturity scale already have established risk teams within their organizations or privacy teams. And where we've seen eSafety is being built out in those organizations is usually partnering with existing privacy or risk management or quality portfolios. So that's how we've seen it happening. If those don't exist within your own organization, you know, there's always somewhere to start, but that's what we've been, the trials are telling us so far.
Thank you. And another question. Do you think it is reasonable for a small family health team to establish an eSafety program?
I do. I think at the very least what we've seen, and we actually had some small family health teams in Ontario contribute, and actually Darren Larson, our HRM champion, comes from one of those. I think it is realistic to assume that everybody has to understand their role, whether they have to develop a formal program or at least identify how they're going to tackle eSafety risks or questions that come up is the very, very minimum. So a formal program in a little family health team might not be realistic, but at least understanding how their team is going to work together to deal with these safety questions as they come up would be very important, because they're representative probably of many others like them out there. In Ontario, if you look at it, most of our family health teams are actually quite small. So really a lot of small adds up to a lot of big in Ontario, and everybody has to take some responsibility. So what we do from a hospital report manager perspective is we encourage those physicians within the family health team to identify any of the issues they're facing, so that at least from an operational perspective, we can understand where those risks are occurring and how to help them deal with them.
Great. Another question in. You mentioned the importance of creating a sense of urgency to establish just the dialogue in eSafety. How does one create a sense of urgency without any formal mechanisms in place that identify the safety risks?
Mm-hmm.
So,
I think most organizations implicitly in healthcare understand the need for safety. As discussed, that culture is there. And a lot of organizations also understand risk management. So if you can actually position this in a risk management discussion, it often helps organizations tackle it. As we know, risks aren't necessarily things that have necessarily occurred, but things that may occur. And being proactive is usually met and very welcomed by a lot of organizations in terms of just showing that you're actually thinking about what can potentially go wrong. So I would say positioning it in a risk management framework is something that most organizations are familiar with.
thank you. Next question. Within the 8 trial sites, have any of them used the approach of expert eSafety clinicians signing off on the solution being fit for clinical use prior to go live?
That's a great question. I would have to go back and actually check with those whether that exact condition was part of their trial for going live. But I have a feeling that would be extreme leading practice. As I said, definitely in the UK, that's the way they work. In Canada, while we look to definitely involving clinicians on our eHealth initiatives to a large degree, having that formal sign-off is a very different thing. So I think that is something I can go back and find out with the trial organizations. But I think from a leading practice perspective, in terms of Canada, our middle ground is that we at least encourage involvement in clinicians rather than formal sign-off.
Great, thank you. Next question. How have the guidelines been incorporated into Health Informatics curriculum?
That's a question we've heard quite a bit around. While we had academics and researchers help us actually create the guidelines, and while we have our certified professional in health informatics credential through COACH, I think the thinking moving forward will be that we really want to start building on curriculum around eSafety. I think formally we're actually taking that away as looking at some of the programs in health informatics to see how we can start incorporating that. To begin with, we've been taking a less formal approach with the National Institute for Health Informatics and Canada Health Infoway and others to spread the word through informal webinars and education development, but I think the idea of actually building this into formal curriculum would be incredibly valuable.
Thank you. Next question. Is COACH interested in publishing any findings down the road about the most common eSafety risks?
Oh, definitely. And I think looking at the recent study that came out from Veterans Affairs in the U.S. gives us some huge indication of where some of those categories and near misses are occurring. So again, what we're really tackling is trying to get more concrete examples around Canada and trying to benchmark through consultation and through including in our health surveys generally, you know, what those examples are. So for sure, we're really trying to encourage people to talk about these events so that we can actually tackle that cultural barrier or fear around exposing eHealth risks. A lot of these projects we've heard internationally, not necessarily only in Canada, but from eHealth experts around the world. These are multi-million-dollar eHealth projects. It's not the easiest thing to do to go forward and say, well, hold on, I want to put a hold on this project while we explore this potential risk. It's not necessarily the easiest thing to do. So it's really, really important to have the ability to change that culture so people feel comfortable to identify those risks.
Thank you so much, Elizabeth. I don't see that we have any more questions. An email link will be sent to all of the registered participants, including an evaluation survey. We hope you will take the time to share your thoughts on today's session.